Hello, friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. Today, I'm extremely proud and privileged to have the sales and service team of Renalogic on with us today to learn a little bit more about their background, history, and experience in the labor market and what Renalogic's doing in the union labor market today. So really excited to have everybody on. Let's bring them on as our guests today. Hello, everybody. What's up? How's everyone?
Hi there.
Well, again, thank you very much for joining the ULA Network and sitting down with all of us today and to learn a little bit more about you individually, as well as what's going on with Renalogic and the services you're providing to our union labor market. So let's kick it off with Tara, learn a little bit more about you, Tara, and maybe you could give us a little bit more of your background and experience in the labor space.
Sure. Thanks for having us, Mike. It's good to see you again. Tara, I am born and raised in Hillsborough. I have been in the labor space since birth. My grandfather is a retiree. My father and mother, both retirees in the labor, steel, and union space. And I really wanted to grow up and do more, see what I could do to help, and went into the healthcare industry. And now I've been working in cost containment, trying to save plans and funds money on high costs of the medical spend in the United States. So I've been doing that now for 25 years.
Wow.
Thanks for having me.
Oh, without a doubt, Tara. I'm looking forward to learning more about your services, what you're doing as well. So how about Josh? Tell us about you, Josh.
Thanks. Yeah, so I'm originally from the Chicagoland area. I moved down to the Sunshine City of St. Petersburg, Florida, almost 10 years ago now, about 9 years. And I started working in Renalogic in January of 2020, right before COVID and all that fun stuff. So that was an interesting start to here. Been working primarily with our labor union clients for the past few years or so, alongside Tara. And what I do at Renalogic is client services, so the onboarding, implementation, as well as the day-to-day reporting type of information, building relationships with our clients. So pleasure to be here, and looking forward to it.
Thanks, Josh. And Tommy?
Thank you, Michael. Tommy Evrage. I'm actually in southern New Mexico. I've known Josh since he first moved to the Sunshine State. I think I was one of the first people that he met out there. But I've been with Renalogic now for about 5 years. And, a little bit about me. I come from a blue collar family. And prior to coming to Renalogic, I really wanted to find a company that made a difference for companies and business owners, for unions and labor, but really for helping people. So chronic kidney disease is something that's close to my heart, and then doing what we do to prevent it and manage costs is very personal for me.
That's right, Tommy. Thank you so much for your overview as well. And as we kick it off, Tommy, maybe you wanted to kick it off with us, just give a little bit more background on who is Renalogic and the services in a little bit more detail.
Absolutely, yeah. So Renalogic's been around for 22 years, primarily working with self-funded health plans and unions all across the U.S. the entire time. We're focused on managing the risk of chronic kidney disease and dialysis. The way that we go about that is dialysis cost containment, so protecting plant assets, reducing the cost of overall dialysis expenses for funds across the U.S. And then we also have clinical programs, really focused on working with members and preventing them from ever getting to the point of going into kidney failure and requiring dialysis.
Gotcha. And Tommy, do you work with all different type of healthcare plans, or how does Renalogic integrate into some of the services, I guess, for the Taft-Hartley market space as well, the healthcare plans?
Yeah, so our dialysis cost containment solutions are primarily aimed at the self-funded funds or those that are level funded. Our clinical programs can actually work with any plan in the United States, regardless of how they're funded.
Okay, thank you. And Tara, when we talk about, can you share some of the background of the chronic kidney disease, and the services as a whole? And for me, going to all these conferences and events, and everybody has a trade show table and a service that's provided. Again, Josh, I think it was a labor management conference that we were at, and sitting down and talking about that. And we actually met a member that was on that kidney list, and just to be able to connect him with you during that particular time, and just understanding those services was incredible. And I know that you had some contacts with him and just trying to, share that education and just guide him down the right path of what he can be able to do. Was really incredible. So I know I talk a lot, but I'll shut up. I'll let Tara talk about a little bit more about the chronic kidney disease facts, and I'll let her take the stage right now.
Yeah, thanks for sharing that, Mike. I mean, that's the number one thing that we do is helping people. Chronic kidney disease is so underdiagnosed in the United States, but it is one of the leading causes of death in the US. It's estimated to be at 9th or 10th leading cause of death right now, and projected to be number 5 by 2040. We're just unfortunately delaying diagnosing people. People with kidney disease are asymptomatic, meaning they don't really feel sick. They don't know what's happening to them. So statistically, diagnosed people, it's a low prevalence of known kidney disease, meaning unfortunately, 1 in 7 Americans have CKD or chronic kidney disease. 90% of them don't even know they have it. Out of half of that population, those individuals probably have a late stage kidney disease and they go unaware. They don't know they even have kidney disease. It's so underdiagnosed, unfortunately. So most of these people are starting dialysis urgently. They're going into the emergency room and starting dialysis because they're in full kidney failure at that point of knowing. That is a huge cost to these funds, and it's a huge clinical cost to these individuals because there is no cure for kidney disease. There's only 2 treatments, dialysis or kidney transplant for survival for people on with end-stage renal disease. And the top drivers of kidney disease are diabetes, high blood pressure. You can see on the screen here, cardiovascular, heart disease, people that are smoking, alcohol. There's so many factors, sleep apnea, obesity, that affect your kidney impairment. So there's a lot of these issues that are caused by lifestyle changes, behavioral habits that are causing kidney disease. So we're not getting healthier as a population. We're an aging population. We're getting sicker. We live, a lot of people live a more sedentary life. There are certain industries that get hit harder, agricultural, municipalities, trucking. I mean, these are things that the unions are all focused industries, right? So it is the higher prevalence for unions seeing people with kidney failure, and the costs aren't going down. The dialysis facilities in the United States are predominantly for profit. So they're making millions of dollars a year off of commercial plans, self-funded plans. When we're getting, funds are getting billed 700% higher than Medicare for the treatment of dialysis. So there's a lot of problems happening in the healthcare industry when it comes to dialysis. And that's why Renalogic was founded, to really help control the costs of dialysis and help these members that are getting diagnosed with kidney disease to identify them earlier so we can get them on a plan of wellness and hopefully maintain kidney function or improve it over time. And if dialysis is imminent, then we're going to help them plan and prepare for that.
I know you were going to talk about some of the union health plans and their members. How does Renal help those particular plans from a percentage standpoint?
Yeah, great question. So we are very member focused. We have a team of advocates and medical team that are nurses that specialize in diabetes, nephrology, to help members and meet them where they're at. So we have 2 programs that we really work with on members. One is our clinical side, and the other is the cost containment side of repricing dialysis claims. We are all about member first, meeting the members where they're at, helping them get assigned to a nurse health coach, an advocate that can work with them, remove barriers to care, whether that be financial, logistical, or even understanding the healthcare system. We have a team of support individuals to help members, whether that be getting, travel, like I said, getting to their appointments, scheduling their appointments, even understanding their condition. Because it's so underdiagnosed, people don't know they have kidney disease, they need to be aware of what kidney disease is, educate them on their condition. Like I said, meet them where they're at, helping them navigate through a complex healthcare system, getting them to the right providers for treatment, working with them on diet and exercise, medication compliance. We have a whole clinical team that will work with these individuals to help them improve their wellness so they can maintain or improve kidney function. Dialysis isn't imminent for everybody. It's only imminent for those individuals that are in full kidney failure. Getting people identified early and helping them with their lifestyle and wellness changes, medication changes, or compliance, getting them healthier, managing and improving kidney function is the number one goal for Renalogic. And since our CARE program was started, we've been able to keep 98.3% of our participants off of dialysis, which is a huge success. And that is all attest to the work that our nurses are doing day in and day out with these members on the plan.
That's incredible. That's really great, Tara. And thank you for sharing that. And Josh, maybe you can go, how do you integrate into some of these healthcare plans right now as well? I mean, if you see the need, you understand what's going on. And I just want to tell you, I'm just as we started to formulate a relationship here, the information that you're putting out on your website, some of the different, itemizing it or filtering it out for union labor specific content and information is fabulous. So I just want to give you guys kudos because I see the growth, happening. I know you're at all these particular events, educating the market on what's going on in this industry. And just again, hats off to you and what you guys are doing. So I want to thank you for that.
Well, thank you. Yeah, we appreciate it. It's been we've been working hard on that. And to answer your question is a great question, right? So how are we integrated? No two health plans are the exact same. So we try to take a unique approach to integrating with how unique the plan is, right? So there's we want to meet with all of the players that make up a health plan. So whether that be the TPA, the network, the consultants, the care management, everyone, to make sure that we're all coordinating as needed and to making sure that we're doing what's right, what's best for the members. And also that will drive down costs for the health plans. So that's the short answer. How we integrate is by uniquely taking a look at each plan and adjusting as necessary.
So you walk in, you work with the fund administrator, understand exactly where everything's going, all the different healthcare plans and how it would integrate. And I guess all the different, pricing codes of how things kind of work into the system. That's your world. I know it gets really detailed. It's pretty incredible how it
absolutely
works.
Yeah, absolutely.
And Tara, maybe you could, how can a fund administrator get in touch with Renalogic? How do you work with how do they find you? I mean, I know you go to the events, obviously, they can reach out to you. I have a ticker right here I'm going to put up as well. Make sure that everybody has your contact information or email at least.
Yeah, no, great question. So any self-funded plan has access to us in the United States. So, any one of us on this team can help you. Reach out, give us a call. You said our email is listed there below, but we can follow up with some contact information. Go out to our website. Our contact information is out there also. As Josh mentioned, we want to work with all of the stakeholders when it comes to a fund administration. We want to integrate smoothly. And so that means your consultant can call us. We will work with your fund counsel, whomever that is on your team that is responsible for managing benefits. They can reach out to us as well. So it doesn't have to, come in one door. Anyone can contact us and we'll be there to assist.
Thank you. Thanks, Sarah. Tommy, any leaving or closing remarks on Renalogic? Any other information you'd like to leave with the audience today?
So I think it's great to ask questions, and it's great to really look into what's driving some of the costs within these funds. Tara mentioned how wildly underdiagnosed chronic kidney disease is. So that makes it hard to drill down and see how many of your members have chronic kidney disease. But I encourage you to reach out to us. We do have analytics software that will analyze claims data, and it's actually 230% better than the market. at identifying those people that have chronic kidney disease but don't have that diagnosis. And that's one of the things that really drives us. And a lot of our results is finding those people and being able to work with them early.
Thank you, Tom. Thank you for that.
Mhm.
I just want to thank you for all that you're doing to help support the union labor market, making people aware of these chronic kidney diseases and the effects that they have on long-term or just people's lives as a whole, and utilizing the technology that you have to reduce operating expenses on the funds as a whole as well, because like you mentioned, some of these costs are rampant and they're baked into certain things that people may overlook. But in today's world where everybody's trying to get more for less or utilize technology to reduce some of those expenses, you guys are at the forefront. And again, I really appreciate everything that you do for labor and for members in the community. So thank you.
Thank you, Mike.
Thank you.
You got it. You got it. Well, this concludes our interview for today. We will have all the information, your bios on the information that we'll get out onto our socials as well. And if there's anybody who wants to reach out, we'll have your contact information, emails and phone numbers. And we'll, again, just thank you for all that you do and look forward to working with you and communicating your message to the masses as well. So thank you.